Hello, I am Dr. Sudhir Kumar, consultant neurologist at Apollo Hospital, Hyderabad, and I welcome all the viewers. And today we are going to talk about one very common problem, that is obesity. So, as we know, it has become a common problem not only in the developed countries but also developing countries like India. And obesity affects people of all age groups, including children and adolescents. And most of the causes of obesity can be attributed to our lifestyle habits, like eating habits, faulty eating habits, or lack of exercise. But there could be some other hormonal disturbances also that can lead to obesity. Obesity is a problem not only because it makes someone looks bad or not presentable, but also it is linked to many serious illnesses like diabetes, hypertension, cancer, heart attacks, and strokes. So therefore, it is important that we should raise awareness about obesity so that we can restrict it, limit it, and prevent obesity. And those who are obese, we can suggest ways to control that. And there are also another angle of psychological problems which are faced by many obese individuals. So today we are here, to discuss ways and to raise awareness about obesity, because World Obesity Day is very close. That is March 4th. And then to discuss more about this, we can't have a much more better person than Mrs. Anuradha Chowdhary, who is a well-known fitness and wellness expert based at Kolkata. So welcome, Anuradha.
Thank you, doctor. Hello, viewers.
So let us, start the proceedings of this webinar. And so to start off with, I want to know from you, Anu, what is the definition of obesity and overweight?
Doctor, overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. Body mass index, that is BMI, is simple index of weight for height that is commonly used to classify overweight and obesity in adults. It is defined as a person's weight in kilogram divided by square of his height in meters, that is kg per meter square. If your BMI is below 18.5, you are underweight. And if it is between 18.5 to 24.9, you are normal weight. If your BMI is between 25.0 to 29.9, you are overweight. And if it is more than 30, then you are obese. For children, please refer to WHO chart as the classification of obesity differs in them.
So in summary, body mass index more than 25 is overweight and more than 30 is obese. That's a very
Obese.
useful piece of information. And now the next question is, how common is obesity in India? We always think that it is not common, but do you have any statistics regarding obesity in India?
Yeah. Overweight and obesity are emerging health problem in India. The prevalence of obesity in India varies due to age, gender, geographical environment, socio-economic status, etc. According to ICMR India Beef Study 2015, prevalence rate of obesity and central obesity varies from 12% to 31% and 17% to 36% respectively. In India, abdominal obesity is one of the major risk factors for cardiovascular disease. Various studies have shown that the prevalence of obesity among women is significantly higher as compared to men. According to National Family Health Survey India 3, NFHS 3, 13% of women aging between 15 to 49 years and 9% of men aging between 15 to 49 years are overweight and obese in 2005 to 6 ratio. Overweight prevalence is higher in urban areas than in rural and lower in the people who involved in agriculture and manual work.
So again, it's a very useful piece of information. What we learned from this is that almost 1 out of 4 persons in India is obese. That's a very
Yeah.
high number of figures, and also it is more common in women. So normally we would think that women do lot of household chores, so they should not be obese.
Hmm.
But many people come to our OPD and tell us, doctor, I do all the housework. Why are you asking me to run and do exercises? So I think what Anu has shown here is that it is more common in women, and that could be linked to their sedentary lifestyle habits. She'll discuss more about that. So going forward, the next question to you, Anu, is obesity a problem only in adults, or even children also have obesity, and how we can tackle obesity in children?
Yeah. Childhood obesity can profoundly affect children's physical health, social and emotional well being, and self esteem of children. It is also associated with poor academic performance and a low quality of life experience by the child. It can be solved by encouraging children to adopt healthy eating behavior and physically active lifestyle. Encourage them to avoid eating high calorie food, drinks, snacks, and junk food, which they always love. Also involve them in any sporting activity. Avoid them just making them a bookworm. So involve them in physical activity, sports, and encourage them to eat healthy foods.
Yes, very useful because if children become obese, they tend to have problems, health-related problems much earlier, and also they suffer from a lot of psychological issues because of they are made fun of by their friends and sometimes even teachers in the school. So that is something to, and not only that, so it's always good to engage, as you said, in sporting activities, which will lead to all around performance, all around development, and not just one sphere of academics.
Yeah. Now I'm going to ask few questions to you, doctor. My first question is, what are the cause and risk factor for obesity?
Yes, I think before we discuss about treatment, we have to also know what makes one obese. So obesity or our body weight, it's a byproduct of what we consume and what we burn. So we need to strike a fine balance between our calorie consumption and how much calories we are burning. If we eat more than what we burn, then the surplus will get converted to fat and it will result in us gaining weight. Similarly, if on the other hand, if somebody eats normally but doesn't do workout also, still that calories can get stored in the body in the form of fat. So less physical activity or more intake than what is required. They are the two main leading causes of obesity and overweight. And the third would be the hormonal disorders. So many glands are involved in maintaining our body weight. In that, hypothalamus, pituitary in the brain, thyroid gland, and adrenal gland. So these are the four glands commonly linked to weight in our body. If any imbalance is there in those hormones, it can lead to obesity. And finally, we should look at family history. If in the family there are many obese individuals, then one has a higher risk of becoming obese.
My second question is, what are the health related complications of obesity?
Yes, so obesity it is not only the cosmetic. Today it is mainly become a cosmetic issue. Many people want to check their weight and they want to get zero figures like Karina Kapoor and other things. Of course, those things matter for people in modeling and movies, but even otherwise, it does make one person gain confidence and have better self-esteem if the body weight is normal. But more than that, there are many complications that can happen in an obese or overweight individual, and there's a huge list of disorders. So the risk of diabetes is more in overweight people, risk of high blood pressure is more, high cholesterol is more, the risk of getting heart attacks, getting paralytic strokes, it is more in obese people. And some even the common things like osteoarthritis, people get knee joint pains in as soon as they reach 50 or 60. That will be much more in persons who are obese. And the many cancers also are linked to overweight and obesity. So we can say, and also not only that, now we are going through COVID pandemic, and we know that the comorbid people who have comorbid illnesses, they have higher risk, and obesity is one of them. So those who are obese, they can have a higher risk of getting COVID infection. And once they get COVID, the risk of COVID-related complications are higher, recoveries are slow, and if anyone needs surgery for any other cause, then post-operative recovery also is much slower, and the rate of complications of any surgery is more in overweight and obese people.
Doctor, are there any psychological effects of obesity?
Yes, as I mentioned briefly earlier, also obesity can lead to low self-esteem, and it is a major cause of anxiety, depression. So many people who are obese and overweight, they lack self-confidence, they lack self-esteem, they lose confidence. They don't want to socialize and mingle with other people. They get confined to their homes or inside the houses, and they don't engage in social activities. And sometimes the depression due to obesity can be so severe that they even contemplate committing suicides, and many suicides do happen also. And this, it is not only the persons doing, but even their friends and colleagues and sometimes family members, they start making fun of these people. Actually, it's a disease, it's an illness. Obesity is an illness also, so we should not stigmatize these people. They need a lot of support and help, encouragement, motivation for them to eat healthy, exercise. As Anu would tell us more about them. So basically, I think now that we know that it has many problems on the health, including psychological, and so it is also important to discuss how we can get over or control obesity, in a better way. So in that, first we know the role of, we keep saying diet is very important, and who better than you to discuss diet? So what are the dietary precautions or dietary habits which one can adopt so that obesity can be reduced and treated?
Doctor, obesity is generally caused by eating too much and moving too little. If we consume high amount of energy, particularly fats and sugar, but do not burn off the energy through exercise and physical activity, much of the surplus energy will be stored by the body as fat. The average physically active men need 2,500 calories a day to maintain healthy weight, and an average physically active woman needs 2,000 calories a day. To maintain our weight, we have to limit our calorie intake. For that, we have to change our eating habits. We have to include more colors to our plate, add fresh fruits, vegetables to your plate, because fruits and vegetables are rich in fibers and vitamins, and it gives the feeling of fullness. Include more whole grain and fat-free, low-fat milk and milk product. Include more protein like lean meats, poultry, fish, beans, eggs, and nuts, as well as seed to your diet. Diet should be low in saturated fats, trans fat, cholesterol. Salt consumption should be 5 gram in a day, not more than 5 gram. And we should avoid added sugar. Stay within your calorie needs. One more thing, the average need of calorie, that is 2,500 for active man, physically active man, and 2,000 for a woman, varies according to your lifestyle. If you are leading normal lifestyle, means a moderate active lifestyle, then it is 2,500 calorie a day for men and 2,000 calorie a day for a woman. If you lead a sedentary life, the calorie intake should be less than this. And if you are leading more active life, then it should be more than this. Means average calorie intake should be more than 2,500 or 2,000 calorie in a day.
I think I know you have given very valuable tips, and all the food items you mentioned, they are easily available in most of the households. So one can easily adopt. And just that, one or two small points I want to highlight here. Many times people, the normal meals, regular meals, they take small amounts, but they have habits of having snacks in between the meals. So when I meet some women, they'll tell, doctor, I have only two rotis, and you're saying, I eat too much. But between the rotis, they go to kitchen, they'll have some snacks, some
Yeah,
mixture,
yeah, yeah.
and then something else. And then also they have the habit of, like, when some food is left over in the end, they want to finish. Why we should
Okay.
waste the food? So I think you also highlighted in one of our earlier webinars about that.
Yeah, yeah, yeah. Women's are
So what?
just a dustbin of a house, kitchen,
Correct.
you can say.
So I think this in between meals snacking should be minimized, or I think, as you suggested earlier, that they can go for some healthy snacks like dry fruits in between, or something
Yeah,
like that.
seeds, dry fruits, because snacks are generally, the snacks has trans fat and high content of salt, which again, good cause of overweight.
Correct. And one more thing which I have noted is that nowadays people would like to watch TV, and then there are a lot of movies, good movies coming. So when they sit near the TV, they'll take one big packet of chips or whatever, popcorn or something, and in no time it finishes. One or two packets will go, and without realizing that
Yeah, yeah.
packet is over, and that is not counted. They say, no, no, but I have not. I had only two rotis, but this is not counted. So when you sit near the TV
They
again,
count only the main meals. Main meals
yes.
they count, and they forget the intermediate one.
So what do you suggest? How do you guide them if somebody wants to watch 3 4 hours of TV, some cricket matches are going on or movies are going on, and what should they do?
Always change your eating habit and lifestyle. And
Correct.
combining exercise with healthy diet is more effective way to treat obesity than depending on calorie restriction alone.
I think
Exercise can increase metabolism and burn calories. It
so.
can
So
also help to
correct.
maintain uh, lean body mass. All the aerobic exercises like running, walking, swimming, cycling, all the high and moderate intensity cardio exercise will reduce our weight. Along with the cardio exercise, we can include weight training muscle training, abs training as well, because it is very needed to tone our muscles and abs as well. One can do 30 to 40 minutes of cardio exercise and 30 minutes of muscle and abs training, which may vary according to your weight.
I think you have given
If a
very
person
well.
is more obese, they can do exercise up to 1 or 1.5 hours.
Yes, I think they are all very easily doable exercise, can be done mostly at home or outside the home. And for many of these, we don't need any good expensive equipments also, as you have highlighted. And some one or two small tips I want to highlight here is that sometimes like we have to go short distance for some nearby shop, kirana shop or grocery store, which may be half kilometer, 1 kilometer. But today's habit is that people just take the car and they want to drive to their place also,
Yeah, yeah.
or nearby some neighbor's house we are going, which is 100 hardly 500 meters. So if we make a habit of walking to these nearby houses, it will be healthy, plus it will help us burn some calories. In a building now, elevators are always there, lifts are there, and we have a common tendency to press the button, use the lift. If we can take the staircase, they have staircases
Yeah.
also. It's not only for in the emergencies or fire, but if you make a habit of climbing 2 3 flights of stairs, at home or in the offices or in an apartment building, so these things would go a long way in making us healthy. So I think yeah, Anu, back to you.
Now, question for you, doctor. What are the medical treatment for obesity?
Yes, so I think I want to highlight here is that the mainstay of treatment of obesity is what Anu has highlighted, that is diet and exercise. So if somebody asks me how to treat, I will say three times the rule number one: follow diet and exercise. Rule number two also is same. Rule number three also diet and exercise. If they still it has failed, so then we go on to medical treatment, and then as of now there are five medicines or five drugs which are approved by FDA for treating obesity, and these are recommended only if diet and exercise have totally failed. And but pills cannot replace. Even if somebody is taking pills for controlling the body weight, they should still follow the diet and exercises. And they are recommended for people whose body mass index is more than 30, or if it is more than 27 with diabetes or hypertension. And for adults, these are meant only for adults. And as you mentioned that children also do have obesity. So in children, if you are using drugs, orlistat can be used. And then, so compared to diet and exercise, if somebody takes this medicine, they can lose additional about 5 or 10% of body weight.
Doctor, what are the pros and cons of liposuction?
Yes, liposuction means it's a procedure by which from a small confined area of body, fat can be sucked out. It looks very easy. Many times people who have tried lots and they don't lose weight, they feel, "Okay, why not let me use some syringe and needle and just suck out the fat." But it's not so easy. It is a surgical procedure. It can lead to complications like infections and some other complications also. So it's not something which should be just rushed and got it. Somebody can get it done, because there are risk factors. So again, here also, first is diet and exercise if they have failed. And then those who are within the 30% body weight. So if somebody's body weight should be, let's say, 60 kg, and it is less than 30% more than that, then they are the ones who can go for this. And they should have good skin also, good elastic skin, and good muscle tone in the underlying underneath the skin, so that the recovery is fast. If they have poor muscle tone, skin is not good, the wound may not heal also. And they should not be smoker, they should be otherwise healthy. Otherwise, smoker means the healing also will be delayed.
Doctor, what are the surgical options for treating obesity?
So as always, surgery is the last option. So first diet, second diet, then exercise, again exercise. All that failed, then there was option of taking pills, and then some selected cases liposuction. If all these things have failed, then surgery is the last option. And then it is only for morbid obesity. Morbid means it is patients are too much obese, like the body mass index more than 40. If you remember Anu's definition, body mass index more than 30 is obesity. So between 30 to 40, we don't have to go for surgery. And so more than 40, or if it is more than 35, but person has one comorbid illness like diabetes, hypertension, sleep apnea, fatty liver disease, heart disease, high cholesterol, then they can go for body mass index more than 35. Also, surgery can be done. And so of course, only for selected number of patients this is suggested. And I think now I have to ask you a few more questions before we come to the end. So in that, one is, okay, now somebody has done all the hard work, they spent 6 months of good dieting, good exercising, and they have now come to the normal body weight. Now, how to maintain the normal body weight? Always we know that it's easy to achieve something, but to maintain that status for, because it's not, we don't have to maintain weight only for just 1 month or 2 months. Go for some vacation, take some pictures, post on Facebook, and then after that forget. Or sometimes people want good wedding pictures, so some girl will they will try to go for a weight control so that the wedding pictures look very good. It's not like that. So we have to maintain body weight for a ideal body weight for a long time. So what are the tips you would give to the viewers for that?
Doctor, I've seen many person, they lose weight easily, but it's difficult for them to maintain throughout the lifespan. So very important question, how to maintain ideal body weight? First is many diets are too restrictive with requirements that are difficult to keep up with. Plan properly before you start a diet. Don't go for crash diet. Many people acquire a diet that is not available easily in our market. The food items of the diet are not easily available in our market and not easy to maintain throughout the lifespan. So adopt a simple diet plan that would be easy for you to continue throughout the life. Second is exercise for at least 30 minutes a day to balance your calorie input and calorie burn. Third is don't skip meal and eat in small portions. Whatever you eat healthy. Add more protein to your diet. It may benefit weight maintenance by promoting fullness, increasing metabolism, and reducing your total calorie intake. Limit your carb intake or take complex carbohydrate instead of simple carbohydrates or refined food. Drink plenty of water, adequate sleep, reduce stress, and have patience because it was long process to gain weight. So losing weight will also take time. Once you lose weight, it is difficult to maintain your ideal body weight throughout the year. So adopt a plan, food plan or diet plan according to your convenience.
I think they are very useful tips. So one should fall in love with the process and not the end result. So we look at the end result. Oh, somebody looks so slim, so fit. So that's fine. But the hard work has gone through it. And once somebody falls in love with the process, that is the process of having healthy diet, process of exercising, and once you keep doing these two things, the end result will automatically come and will be maintained. So very useful tips. And then I think finally, I'd also want, somebody may not be obese now, may not be overweight, but what can they do so that they don't become overweight and obese in future?
First thing is change your lifestyle. Lifestyle include eating healthy and regular exercise. Keep yourself active and stress free. Keep eye on your weight regularly. We had a good session on obesity, doctor. Can you summarize our discussion for the benefits of our viewers?
Yes, I agree with you. I think we discussed comprehensively about all aspects of obesity. To start off with, you gave the definitions, what is obesity. So anybody having body mass index of 30 or more, it is obesity. And then you highlighted that, it is quite common. Out of every 4 person, one is obese or overweight in India. And then you mentioned that even children have obesity and overweight problems. So we should not ignore that age group, and we should inculcate them in sporting activities and make them physically active also other than studies. And then we discussed some of the causes, what causes obesity. So mainly it was taking more food than what is required, and burning less number of calories, and few hormonal disorders can cause. It has serious impact on our health, leading to many disorders like diabetes, high blood pressure, cancer, heart attacks, and paralytic strokes, and also arthritis of the knees. And then we looked at it can lead to many psychological effects also, like poor self-esteem, depressive illness, the higher risk of suicides. And then after that, you mentioned in detail about what kind of diet a person, obese person, take to reduce the body weight, what exercise can be done, and you gave some very easy tips to follow, which can be sustained for long duration. And then I discussed about some of the, if diet and exercise fails, we have options like medicines, liposuction, and surgeries in selected cases, not for all. And then finally, you discuss about how the body weight can be maintained after having lost it. So I think these are the main points that we got, and I think our viewers must have learned, some useful information about obesity today.
Thank you, doctor. Thank you, viewers, for watching us. Do like our show. If you have any queries, write there in our comment box. Thank you, viewers. Again, thank you, doctor.
Thank you, Anu, and thank you all the viewers. And I think we'll be back soon with another topic, another show very soon. Thank you.